Good evening, and welcome to our special report. Tonight, we're diving deep into a subject that impacts every one of us, yet often remains hidden in plain sight: the profound link between climate change and the alarming rise of future pandemics. For too long, we've viewed these as separate challenges, but the reality is that our changing climate is not just an environmental crisis, it's a monumental global health threat, actively creating new pathways for infectious diseases. We'll explore how shifting weather patterns, ecological disruptions, and human activity are accelerating the spread of pathogens, putting communities and healthcare systems worldwide under unprecedented pressure. Understanding this intricate connection is crucial for safeguarding global health and preparing for the health crises of tomorrow. Our planet is warming at an alarming rate, and this isn't just about melting ice caps, it's about creating new, fertile ground for disease. Rising global temperatures directly impact the life cycles and geographical ranges of pathogens and their vectors. Extreme weather events, from prolonged droughts to torrential floods, disrupt ecosystems, forcing both humans and animals into closer contact, facilitating the jump of diseases across species. Moreover, these events damage public health infrastructure, displace populations, and create ideal conditions for microbes to thrive, essentially fast-tracking the evolution and transmission of infectious agents. It's a cascading effect, where every environmental shift nudges us closer to the next widespread outbreak. Perhaps the most direct link we see between climate change and disease is the expansion of vector-borne illnesses. As temperatures rise, mosquitoes and ticks, the primary carriers of diseases like dengue, malaria, and Lyme, are expanding their geographical ranges into previously unaffected regions. Warmer winters allow these vectors to survive longer and reproduce more. Increased rainfall can create more breeding grounds for mosquitoes, while droughts can concentrate populations around diminishing water sources, increasing human vector contact. This means that illnesses once confined to tropical or specific temperate zones are now emerging in new communities, posing unprecedented challenges to public health systems unprepared for these invaders. Many of the most devastating pandemics, including COVID-19, are zoonotic in origin, meaning they jump from animals to humans. Climate change significantly exacerbates this risk. As habitats are destroyed by deforestation, urbanization, and extreme weather, wildlife is forced into closer proximity with human settlements. This increased human-wildlife interface provides more opportunities for pathogens to spill over into human populations. The 75% of new infectious diseases originating in animals statistic is a stark reminder of this danger. Disruptions to ecosystems can also stress animal populations, making them more susceptible to disease and more likely to shed viruses, creating a perfect storm for the emergence of new, potentially pandemic-level threats. The health impacts of climate change don't just manifest as new diseases, they also severely strain our existing healthcare systems. Climate-fueled disasters like hurricanes, heat waves, and wildfires can cause significant infrastructure damage, destroying hospitals and clinics, disrupting supply chains, and overwhelming emergency services. The displacement of millions of people creates humanitarian crises, often without adequate access to medical care, exacerbating existing health disparities. Vulnerable communities, often those with fewer resources and pre-existing health conditions, bear the brunt of these impacts, facing higher risks of illness and death. Our ability to respond to routine health challenges, let alone a new pandemic, is severely compromised when our systems are already overwhelmed. The consequences of neglecting this intertwined crisis are staggering, extending far beyond individual health. We're looking at an enormous economic burden, from healthcare costs, lost productivity, and disaster recovery. Entire livelihoods are disrupted as agriculture suffers, industries are impacted, and communities are uprooted. This fuels social instability, creating a cascade of humanitarian challenges, from migration crises to resource conflicts. The lack of global cooperation in addressing both climate change and pandemic preparedness leaves us exposed, weakening our collective ability to respond. In essence, the cost of inaction is not just measured in dollars, but in human lives, societal cohesion, and the very stability of our planet. While the challenges are immense, solutions exist, and they demand immediate, decisive action. We must prioritize aggressive climate action to reduce greenhouse gas emissions, mitigating the root causes of these threats. Simultaneously, we need massive public health investment, strengthening healthcare infrastructure, improving disease surveillance, and expanding access to care, especially in vulnerable regions. Developing robust early warning systems for both climate events and disease outbreaks is critical for timely response. Crucially, this requires unprecedented global collaboration, sharing data, resources, and expertise across borders. By integrating climate and health strategies, we can build more resilient communities and a safer future for everyone. The fight against climate change and future pandemics isn't just for scientists and policymakers. It's a collective responsibility that starts with each of us. Your voice matters. Make informed voting decisions that support leaders and policies committed to climate action and public health. Embrace sustainable choices in your daily life, reducing your carbon footprint. Engage in community efforts to build local resilience, from supporting local food systems to preparing for emergencies. Most importantly, advocate for change. Speak up, educate others, and demand that our governments prioritize these interconnected threats. Together, we can turn the tide, protecting not only our planet, but the health and well-being of generations to come.